Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Types of the epiphysis. So there are four main types of epiphysis. First is the pressure. So pressure epiphysis, the articulating and the assist in the transmission of weight. They are found in regions in which the bone that are under pressure during the movement of locomotion. So it's under pressure during the locomotion. Next comes examples. Examples, it includes the head of the humerus and also the head of the femur and the condyles of the femur and the tibia. Next is the traction epiphysis. So traction epiphysis, it is non-articular and they do not transmit weight. So no transmission of the weight. Next is it provides attachment to one or more tendons. So it provides the attachment to one or more tendons that exert traction to the epiphysis. The traction epiphysis, it ossifies later than the pressure epiphysis. Traction epiphysis, it is later than the pressure epiphysis. Examples, it includes the greater and the lesser tubercle of the humerus. The greater and the lesser tubercle of the humerus. And there are also the greater and the lesser trochanters of the femur. Then is the atavistic epiphysis. Atavistic epiphysis is an independent bone in the lower animals and independent bone in case of the lower animals, but in humans has fused to another bone. Next is, what are the examples? The examples, it includes the coracoid process. So coracoid process is fused to the scapula in the humans, but separate in case of the legged animals. Then is the aberrant epiphysis. The aberrant epiphysis is a deviation from the normal and are not always present. They are not always present. So the example, it includes the epiphysis of the head of the first metacarpal, and also the base of the other metacarpal bones. To learn and grow daily like this, please do subscribe.